Are you sick of being sick during cold and flu season? What if I told you that your bifidobacteria could be the difference between life and death when dealing with a severe respiratory virus? That get your attention? Are you guys ready for cold and flu season? In a typical year, the CDC is going to estimate that between 9.3 million and 41 million flu cases are going to happen, of which 120,000, 710,000 of those people are going to be in the hospital, and between 6,300 and 52,000 people are going to die. During the COVID-19 pandemic, there were over 104 million confirmed and presumed positive cases and 1.1 million deaths in the U.S. alone. COVID-19 was the third leading cause of death in 2020 and 2021, fourth leading cause in 2022, and the 10th leading cause in 2023. So ultimately, it seems we just have to suck it up and deal with it, right? Wrong. Guess what? Science says that you can prepare. Your gut microbiota has a major effect on your susceptibility to COVID-19 and seasonal influenza. Recent studies have found that regulating your gut microbiota can promote immune effects against influenza via the gut-lung axis, and this includes promoting influenza clearance in early stages of infection, reducing inflammatory damage in the later stages. Dr. Sabine Zahn at Bifidobacterium hypothesized that low bacterial diversity and depletion of Bifidobacterium genre before or after infection led to reduced pro-immune function, thereby allowing COVID-19 infection to become symptomatic. This particular dysbiosis pattern may be a susceptibility marker for symptomatic severity of COVID-19 infection, may be amenable to pre-infection, intra-infection, and post-infection intervention. So here in figure 7, what we have is the potential mechanisms for cytokine storm and immune hyperresponse for C19. In infected individuals, the macrophages become activated, which activates the T cells, additional macrophages, and neutrophils, all releasing cytokines, including tumor necrosis factor alpha, which there's your cytokine storm. Bifido in sufficient numbers combine to tumor necrosis factor alpha and prevent the cytokine storm. Patients with bifidobacterial dysbiosis lack this defense, and this may lead to a cytokine storm. So, as she said, boosting the bifidobacteria is going to improve your chances of outcome, as you can see here with the list. Ironically, it happens in influenza as well. Kawahara et al. Oral administration of MM2, which is a product of bifidobacteria, for 17 days activates, well, a product containing bifidobacteria, for 17 days activates systemic immunoreactivity, which contributes to your innate immunity, including natural killer cell activation, resulting in anti-influenza viral effect. That same product, as a probiotic, may function as a prophylactic agent in the management of influenza. Grieger et al. Intranasal administration of Bifidobacterium longum is this isolated cell wall prior to virus inoculation significantly reduced viral load within the lungs and significantly improved survival. Let's talk about Bifidobacteria, since we know it's going to be so beneficial based upon the research. The genes of beneficial gut bacteria commonly found in gastrointestinal tracts of humans and other animals, particularly present in infants and breastfed babies. It is a gram-positive, anaerobic, non-motile, non-spore-forming, Y-shaped bacterium. Metabolism has fermentative metabolism. It's a fructose 6-phosphate shunt, and its primary products are acetate and lactate, which are important for the gut pH and inhibiting pathogens. The ecological role: early colonizer of human gut, declines with age, you got to keep it up. Symbiotic, compete with pathogenic bacteria, and contribute to colonization resistance. Produces some B vitamins and vitamin K. Health benefits: as we have stated, works on modulating the immune system, regulatory T cells, anti-inflammatory cytokines, strengthens your gut barrier, protects against infections through competitive exclusion, production of acids and antimicrobial peptides. So it's basically an antibiotic in your gut. Reduces inflammation and supports indigestion. So based upon that, I want to say thank you for coming to the TED Talk. And it would benefit each one of you to look into how you can supplement and increase your Bifido species abundance within your gut. And then now that we know this, next cold and flu season, get on top of the Bifido species supplementation, get them up in your gut with your pre and probiotics, and you will find likely that your experience in the next cold and flu season may either not be an experience or it would be much better. Thank you.